I am so excited to speak to Jackie Rotman today. This is an interesting type of conversation for us. We're normally talking to healthcare professionals or business people, and today we're speaking to someone who's really focused on advocacy and changing the barriers that are in place to be able to advertise women's health products or products for people with vulvas, as she says. And you know, I've been talking about this for 12 years and I'm blue in the face. So I'm thrilled that there's so many people who have joined the fray in the last decade or so. What's really interesting is, Jackie takes the approach of what has happened to these businesses. And the second piece of that, which we focus a lot on, is what are the implications of the fact that these companies can't advertise for patients, for consumers, for people who walk into your office? Because there's one thing not to know about a product, but the other function many of these companies serve is education. So what happens when you can't get the education that you need to make decisions? I think lots of those people wind up not having a physician like you and not really getting the direction that they need.
Well, listen, this hits us in the healthcare field as well. I mean, I'm a gynecologist for 25 plus years. I should be able to speak in normal anatomic terms, whether it comes to being in media or whether it is, trying to educate patients. I cannot imagine a gynecologist that refers to the vulva as down there.
It's so interesting. You told a story recently about how you were, in the green room. And for people who don't know what that is, that's when your makeup and hair is all done and they're about to bring you out on TV and they saw the name of your book that had the word vagina in it. And so they literally pulled your segment at the last minute. And I think what you said was that they didn't think that was appropriate for the morning. It turns out they don't think it's appropriate for the middle of the day, the afternoon, the evening.
Well, you know what? To be fair, that was back in 2012. I do feel that things have gotten a little bit more comfortable over the years, but surely there's a lot more work to be done.
And it looks like, based on conversations like today, we're making progress in those conversations.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest today, Jackie Rotman, who is the founder of the Center for Intimacy Justice, who has just released a report that's getting all kinds of press. So there's lots to talk about. Jackie, welcome.
Thank you so much, both of you, for having me.
So tell us a little bit about the Center for Intimacy Justice and how you decided to found it based on your experiences and background.
The Center for Intimacy Justice is a nonprofit, and our first issue area is working to change advertising barriers that are discriminating against health of women and people with vulvas. So we're taking on policies at places like Facebook to allow these ads. A lot of tech companies are misclassifying advertisements as adult products when they're crucial health advertisements. I started in 2017 having various experiences that inspired me and led me to create the center. I have an unusual father who's very sex positive and empowering. And since my grandfather, the men in my family have given basically my grandfather gave a talk to my dad when he was a teenager about the female orgasm and dispelling myths to make sure he knew about the clitoris. And my dad gave my brother that same talk when my brother had his first girlfriend. And so I was sharing certain experiences with my dad in a class at Harvard Kennedy School in 2017, when I saw that people's responses were so powerful to be having these conversations about sexuality in a healthy way. So that led me to want to work in sex tech, and then subsequently had experiences more on the discriminatory negative side of experiencing sexual violence and how the systems were set up in ways that were perpetuating it, and decided in 2017 to work on these areas full time. And the Center for Intimacy Justice will take on other issues longer term, but this is the first.
Amazing. Your dad is like the most forward-thinking, progressive guy I can't even imagine. So kudos to him for that. I want to just bring you a little vignette that I think will resonate with you. So I wrote a book in 2012 called V is for Vagina. I was sitting in a green room ready to go on morning TV to talk about my book, which frankly is a gynecology and medical book for lay people. And I got booted 10 minutes before I was supposed to go on because advertisers were very upset about using the word vagina at such an early morning hour. So where were you when I needed that kind of help? And how are you managing this, at this time?
Yeah, and Rachel's, been speaking out about this too, since I think I've read your 2010 New York Times article about the 95 outlets that turned down your advertisements. So this has clearly gone on for a long time. It's amazing that so many people have done incredible advocacy, and yet we're still coming together and finding more new strategies to deploy to address this long-standing issue.
So give some of the highlights of the study. It was published in the last couple of weeks, early 2022. You did a lot of work. Share with us some of the sort of, oh my God, findings that wound up getting the report in the New York Times.
Definitely. We interviewed and surveyed 60 companies from fertility to contraception, a variety of health companies supporting people with vulvas. And out of the 60, 100% of them had experienced Facebook rejecting an advertisement, at least one, but often many. And 50% of those companies had their entire accounts shut down at some point by Facebook. Of the 60 companies, 59 of them were founded and led by at least one woman, and one of them was founded by a non-binary person. So it was having effects on economic well-being of women and non-binary people in addition to health. And most commonly, the reason is that Facebook misclassified the ads as adult products and services, but adult content, which is their nudity policy, was also sometimes cited, particularly for the lactation-related companies. And we found that the impact was massive in so many areas of our society and of women's health.
It's important to note that while these ads were getting rejected and 60 out of 60 companies were rejected, that erectile dysfunction ads were run freely, and there's no need to take those off. But if you're going to have policies, apply them equally.
I have a question for you though, because on the one hand, we don't want to medicalize sex toys or lube or some of these things, but on the other hand, it seems that the male counterpart did medicalize it. They turned erectile dysfunction, or appropriately stated it as a medical issue, and maybe that's how they were able to have their platform. I mean, what say you about that? Is that the way to go? Should we medicalize this?
Interestingly, in addition to medicalizing erectile dysfunction in itself, the fact that there was research that showed that erectile dysfunction was correlated with cardiovascular issues and heart health also was one of the arguments that were leveraged to get those ads through. And you think about, if we thought about sexual health for people with vulvas, I'm sure it's associated with lots of other health benefits beyond sexual function that we haven't invested the research to study. And there could be other arguments that we could make. It's interesting. I've had that thought as well. There is an FDA classification for sex toys around, something like genital massager, or they have an FDA term. Most of the women founders in the sexual wellness space have not gone the route of FDA approval. And I think part of it is that, like you've alluded to, a lot of them don't want to over medicalize it. Women don't want to feel that they have a medical problem when they need support with vaginal dryness or support with other aspects of sexual function. So the common trend has been that founders haven't taken that route of like an FDA medical device, but it's certainly an option. And I think that as Facebook hopefully improves this policy over time, they could create a verification program to show that you're a health company rather than, an adult company that it doesn't want to allow. And one way to do that would be clearly distinguishing health products. I'm not saying that is the way to go, but it's an option. If you could approve FDA approved products, there should be others beyond those that are accepted, but it's one option.
So I think that idea of classification also has a lot to do with the psyche of men versus people with vulvas. So one of the things that I thought was so brilliant, and continue to think is one of the most brilliant advertising campaigns ever, is that when you talked about erectile dysfunction, the side effect, which was erections may last more than 4 hours, became by default a benefit. And
that
when
was
you
a side effect at first.
Yeah, when you call it a dysfunction, it says to the user, it's not your fault, it's not about you. And when we talk to women working in lots of companies in this space, they all said what you said. Don't tell me there's one more thing wrong with me. I don't need to have another dysfunction. I don't need to be putting on hand cream, face cream, hair gel, waxing, whatever are their beauty rituals, and now being told that there's something wrong with my sexual response. So I think it's marketing and it's communication. But I have a question about what is the impact of this, not just on the founders who are having difficulty raising money, and not just on those companies that are trying to advertise, but on the people who are not getting access to this valuable information. So Alyssa, what do you see? I mean, are you seeing this lack of access, at least for the 60 companies that Jackie looked at in depth? Is that being reflected in your patients, that they are missing some critical information when they come into your office?
I think there are more resources than there have ever been historically. The question is, are they accurate, or is the information that's out there, full of misconceptions and misinformation? I just have such an issue with Facebook/Meta, or whatever they want to be called at this time, because I'm a gynecologist and I'm going to use the word vagina and vulva, because if I say something like, how are you feeling down there? I mean, I sound absolutely unprofessional, and that's not the way people in my field discuss anatomic parts. And this is similar to, if I was going to ask, does your male partner's penis get erect during sexual function? I'm going to ask about, does the vagina get adequately lubricated? And I think that the professionalism should be brought to some of these internet platforms as well. But I do appreciate there's a fine line. As far as education, look, by the time people are coming to my office, they've attempted to educate themselves a bit. And oftentimes I have to dispel some of the misinformation that they've either gotten from friends, cohorts, internet, or whatnot. And it really should start early, like with our dads, as you mentioned there.
Wow, MVP, Hall of Fame dad. There is also, we've talked about this before, a growing body of research that suggests that young boys and girls who are taught the right names for their genitals and their body parts and what they do and what they're capable of doing and how they might fit together are more likely to report instances of assault or trauma, which unfortunately is incredibly common. But at least if you're using the right language, a child could come forth and say, this is what happened to me. And I know that's very dark, and we try to be uplifting and positive, but it is a reality that education does matter. It gives us language. It maybe prepares you and protects you in certain ways. So I think that's critically important. What has been the response, if there has been? I know what it has been from the women's wellness community. It's, cheers all around and standing O's. Have you had much response from the medical community?
People that are educators in sexual health have been extremely supportive about these findings, particularly because TikTok and other social media platforms are also censoring on content, not just advertising. So a lot of educators who are using social media have deeply resonated with the issue. In terms of the medical community, we've had some early conversations with the American Medical Association prior to this report and had interest from staff. The next step would be bringing that to physicians there to have this be a part of their policy priorities. But we've also seen an amazing response from the from politicians and policymakers on this as well.
So here's today's hot flash, Rachel. Published in the Journal of Sex Research, 67% of heterosexual women admitted to occasionally faking orgasm. Newsflash.
Which is exciting. But like Thanksgiving, we're not going to talk politics on Business of the V, although there's a lot to cover there. So share some of so you started in this field, your grandfather was ahead of his time, your father was ahead of his time, your brother probably had a very happy first girlfriend, and you've decided to make this your career. So the topic is complicated and it's consuming and sometimes it's difficult. What keeps you passionate and enthusiastic? You know, you really are digging through some tough issues that will take a long time to change, whether it's through the political system or the social or the capitalist system. So what keeps you motivated?
I feel really inspired by entrepreneurs in this space, especially in 2017 when the Me Too movement was happening. Every entrepreneur I encountered who was starting a business to improve women's sexual lives, I thought was so courageous, so innovative, and they give me a lot of energy. And in terms of, I also get a lot of energy from women who have advocated, who were from generations prior to me. I think about people like Catherine McKinnon, who advocated for sexual violence, 50 years before the Me Too movement, when there was no recognition for decades and decades of that social issue in the way that there is now. And so I feel like this work is on the shoulders of other rights that women before us have fought for, that we're even able to have a business for CIJ and have a bank account because of reforms that other people fought for. So being able to take women's equality to other levels and fighting for issues of our time, especially when they are technological and they are algorithmic, and the fights around gender equality are happening on the internet now. It's such an exciting time to do this work, and the incremental changes or the systemic changes that you can create if you can fix these algorithms and technological problems can be massive.
One of the things that I get asked a lot, having been in the space a long time, is, wow, did Me Too really change things? And from the business perspective, what I think it did more than anything else was make some of these conversations easier to have. They didn't feel so unusual, and lots of people were talking about related issues. I think at that point, we would have loved to see just a groundswell of change. And in this space, you take 2 steps forward and 1 step back, and it takes the whole community to push things uphill. Alyssa, when you're in your office, what do you find are the areas, there's so much education that we're not getting, and we've talked about before how these companies take on the role of becoming educators, or people like Jackie take on the role of becoming educators. When people come into your office and they're experiencing something they've never experienced before, something traumatic, are they prepared? Do they have information? Where do they go? Because for some of the topics you're talking about, serious things, not that all the things you talk about aren't serious, but they're coming in with important issues often. Sometimes it's way more than just an annual healthy checkup, you're good to go.
Oh, all the time. So, this whole issue of assault and the Me Too movement and whatnot. I mean, listen, my office is not a political place, and it never will be. But what I feel is that I'm often the last person included as a gynecologist, because many women who are off at school or maybe in the workplace who might have experienced an assault or something along that line, they go through their process with friends or with family or with a therapist, and I'm often the last one to know. These are things that always surprise me. Their biggest concern in my office is, can you just test me for sexually transmitted infection? So I get that, and that's easy. And, you know, we provide the appropriate counseling. Most people that I see don't really want to go into any sort of a legal situation, because somehow or another, they get dragged through the mud more than the person who might have committed these horrible offenses. And number three, I find they just really kind of want to put it behind them and move forward. So I feel like I'm kind of the last person to know, and just really kind of managing the medical sides of things. And hopefully your organization is going to bring this more to the forefront, so people know what to do and they don't feel like they're a victim twice.
Yeah. Intimacy justice is an interesting choice. Your first effort is advertising. What's behind that? Because intimacy justice sounds really big and really important.
Yeah, there's this amazing research by someone named Sarah McClelland. I believe she's I think she's at University of Michigan. And she did this research that asked women and men about their sexual satisfaction. And women reported, so the experiences that women shared were objectively worse across 5 of the 6 measures. They were having more pain. They were not having orgasms as frequently. But the one metric that men and women reported having the outcomes on were satisfaction. Women were saying they were just as satisfied as men were saying, with objectively worse, measurably worse sex. And it says so much about what we believe we're entitled to, where we actually thought we were entitled to less positive experiences, and it became so normalized. So Sarah McClelland invented the word intimate justice, actually, she called it. And it was about this point that we experience power and inequity issues in all areas of our lives, and intimacy is not excluded from that. I can think of so many examples, even in consensual relationships, where my well-being simply isn't as important as a male partner's. So that was the research and the framing that led to our name. We say intimacy justice instead of intimate justice, but longer term, we'll take on a lot of different issues. I'm really passionate about restorative justice and transforming the reporting systems to sexual violence and making those actually healing focused. So that's an area we're really passionate about. And we're also going to be taking on certain family law issues in the future, particularly around alternative family structures and people that don't fit into our common represented families.
It's so interesting, that research and that you spoke about, and that it led to the naming of your organization, because I've always heard, from the business side, that, there's this enormous orgasm gap that lots of the businesses in this space are trying to narrow, that 30% of women never have orgasms, that men, this is one of my favorite studies, when they asked men if their female partner had an orgasm, they said, absolutely 90% of the time. And when you ask those same women in those same settings, if in fact they had an orgasm, it was something like 60 or 62% said yes. So this idea of the orgasm gap and this, differentiation and satisfaction, I think is getting its due to many of the companies that are working in this space right now. Alyssa, how often does that come up? I mean, I know you ask about it. And one of the things, Jackie, that we hear over and over is, after anyone hears Alyssa speak about any of her approaches to medicine and patient care, they always wish that she were their doctor. So I'm saying that with a caveat that most of the ones we hear about are not as compassionate as Alyssa. But are you talking to your patients about satisfaction and things they can do and expectations and all those things?
Yeah, I mean, we discuss sexual health at an annual visit. Sometimes people come in for a directed visit regarding a concern that they have. But I don't think women come in and tell me that they're faking their orgasms all the time. They just tell me that they are looking to enhance it, and what can we do? To your point, there are just so many things that go into satisfaction for women. And I think that men have an easier time putting the rest of their lives on hold for sexual activity, and women are busy multitasking with, the laundry list of to-do things, and that they have to put aside a little bit. But look, I think the biggest issue that we've spoken about and touched upon is education. And a lot of women just want to know whether they're normal. Is it normal that I'm not having an orgasm every time I have sex? Is it normal that intercourse is not what's bringing me to orgasm? And that's the typical type of conversation where I'm trying to provide reassurance and assistance.
And it's so interesting just how different, and so much of our education is, biased to heteronormative relationships. But this idea you mentioned early on, Jackie, about Viagra, we used to go into pitch when we're trying to raise money for sexual pleasure companies or desire, things that improve desire and arousal. Try to find the woman who would raise her hand and say, yes, I'm absolutely dying to improve my sex life and take the risk of cardiovascular issues, blinding headaches, and loss of color vision, which are the three major side effects of those erectile dysfunction drugs. So I think it's really, really important, since we started with the discussion of Viagra early on, to understand that there are not just two groups of people. There are not just one way. There aren't just two ways to do things. That we're talking about, a much more fluid gender discussion and set of activities, and our medical professionals and our educators have to be cognizant of that they're speaking to a different group than they might have been speaking to before.
Jackie, I'm so curious if you feel this is progress or negative progress. When the FDA approved the first medication and then the second one for female sexual dysfunction or hypoactive sexual desire disorder, was that a big win in your opinion, or not so much? Because I know there's a lot of controversy around that.
This was for Addie.
It was for Addie, and then the second medication that's been approved is Vyleesi, an injection for on-demand use for sexual dysfunction and hypoactive sexual desire. So, of course, this is meant for women who are distressed by this issue. Plenty of women just say, or it doesn't matter to me, but I'm just curious whether, based on your background and this amazing non-for-profit, is this a win or a loss? Because there really are two schools of thought on this.
Yeah. And just to clarify, is it about the drug itself, or more the question around, should we have a disorder for hypersexual, the desire, should that be a disorder, or either part of this? Because there's two ways I could answer it.
However you'd like to comment. My question is, do you feel that this situation was medicalized so much that medications that were approved by the FDA, like Viagra or the other ED meds, is that a win for women or a step backwards? Because there are, some who have the opinion that actually this was medicalized way too much, and that the medications were approved, simply so that it could be a good business decision.
Yeah, I am more on the second part of it. There used to be this study, I can't remember if it was in the 80s or the 90s, but it said that 43 women experienced sexual dysfunction, and it was all about making it, this sexual dysfunction issue. And I don't use those stats anymore for a couple reasons, but one is that the medicalization of sexual desire, number one, it wasn't inclusive to people who are asexual or don't experience sexual desire, for whom that's completely fine. The DSM used to say that being gay was a disorder. And similarly, a lot of asexual people have problems with the idea that hyposexual desire disorder even exists. So in my first New York Times op-ed, I took out the section about sexual desire to try to be more inclusive and accepting around asexuality. And of course, for women, sexual desire is so complicated, and we don't have to be on and have sexual desire all the time. It's okay to be in touch with our bodies even when we don't have desire. So I think that making sexual desire a disorder was over medicalized and not completely in touch. And then, of course, the drugs themselves and the FDA, there's different schools of thought on Addie, and it was very controversial. And I think I'll defer to more of the medical experts on that instead of taking a side. But it's been a fascinating history of that drug.
No, I just wanted to get your food for thought because, you know, it seems like it's something that's somewhat up your alley. So thank you for your very honest answer.
Yeah, it was interesting that. Okay. I was gonna say that there was one sentence in my first op-ed draft that I probably researched 10 hours of medical journals about, was I going to list women's lack of sexual desire as one of the symptoms that I mentioned alongside other, sexual challenges that I did include. And I just took the whole sentence out because there were so many issues with medicalizing that as an issue. And so I deleted it all.
Understood. I think for me as a gynecologist and a person who really is on the front lines of patient care, and I do focus a lot of my visits on sexual health, there are some people who are really distressed by this type of thing and others who really couldn't care less, and they are not finding themselves in a bad position. So there's a lot of ways to view this.
And I would say, as someone who went to all those hearings and sat through them, that is such a spirited and long and important discussion with so many different twists and turns, but it was quite an experience and gave me a very different perspective seeing it up close. Well, Jackie, we wanted to thank you so much for taking time. The work you're doing, certainly it's so important to my work and to Alyssa's work, and we appreciate you taking this huge challenge and trying to move it forward and making real progress.
Thank you so much. Thanks for having me.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.